Hello, it's Phil.
Hi, it's Bindi.
So today we're going to talk about the way the foot affects the rest of the body. So just like the foundations of a building affect what happens to the building, so the foot affects the rest of the body. So a great example I often use with patients is if you've seen the Leaning Tower of Pisa, the building is fine, it's just the foundations went wonky. So the same thing happens with the body if the feet aren't quite right. So I'm going to start with the foot and Bindi's going to do the knee, and then we're going to work further up from there. So the foot is an amazing contraption. Its job is to get us around. It's got to be flexible enough to handle rough terrain, and that's why there's a quarter of the bones in your body actually below the ankle. But it's got to be rigid enough and firm enough to push our whole body weight through these five bones at the front here. So the most common problem we see is feet that are flat, so feet that want to pronate too much. So from the front, it'll look like this, they're collapsing inwards. Feet can also roll the other way as well and do all sorts of other things, but the most common problem we see is pronated feet. So when the feet pronate too much, or the arch collapses down, what we see is an internal rotation of the tibia. So the whole leg will twist in that way as the foot pronates. So that's not good, and Bindi will explain why now.
Okay, so this is the tibia, continuing up. So as that's rotated inwards, the femur that's just above it ends up rotating slightly out, but also outwards. So when that's happening, you've got malalignment of the knee, you get potential injuries in the knee, so you wear out the menisci or you've had injury to the ligaments. So they're the potential injuries that happen further up because of that incorrect alignment.
Down at the foot. So as we continue up, coming up from the femur, which is the thigh bone, up into the hip. So when the foot is pronating, we can get that valgus in the knee, so an internal rotation, and internal rotation of the hip as well. This is not letting me do it very well, but internal tilting forwards. Now that can affect, obviously, in the hip joint itself, up into the posterior hip, so some people can get sciatic issues and a lot of wear and tear in through the muscles, having to work a lot harder there. We also see usually an anterior pelvic tilt. So we see the pelvis tilt forwards. Now that's going to affect the lower back. So a lot of the people we see with flat feet will actually have lower back pain. Now, podiatrists aren't the only people involved in helping people with lower back pain, but if you have lower back pain and you're doing all the things that you should, exercise and strengthening, and you're still getting that problem, come and get your feet checked, because that's obviously an issue that can happen up there. So from all the way from the foot up into the lower back, they're the main areas that we see problems from feet that aren't quite lined up. Now, if you do have issues, we want to sort of explain our process here at Pioneer Podiatry and what we do. Your first question will be what is wrong when you've got a pain, and that's our job, is to give you a diagnosis. The second thing we do is we explain to you why it's happened. So we want to explain the mechanics and the function of why that it's happened. And the third thing we want to do is give you an outline of how we're going to get it better. So it's really just a three-part process that we use. It gives a lot of clarity and certainty of how long it will take and what treatments we'll use. So we actually use a document here. This is our proven process for a lot of our musculoskeletal conditions. So that's conditions that are relating to the bones and the muscles and the tendons of the body. So this is our treatment plan. So you can see it starts with pain and gets back to full recovery. And we'll do different treatment plans and different processes. So every new patient we see will get a roadmap basically to recovery. So think of us if you are having foot or leg pain, because we can very much help with those things as part of your healthcare team. Okay, we'll keep this video a bit shorter today, but thank you for watching, and we'll see you again another day.
Yeah. Bye.
Bye-bye.